So starting out with treatment of the anterior chest, very, very important area to manage when it comes to people with either breathing dysfunctions or some limitation in range of motion. Now, what's on the most front portion is we have the sternum, we have ribs. So the individual that is kind of compressed down, poor posture, really has this really difficult ability to open up, like maybe someone that sits at a desk all day. The first thing we want to do here is really work to decompress the ribs away from the sternum. Then we can work on improving the ability for the sternum to elevate through using breath work. So let me show you briefly what that looks like. Keely doesn't really need all this work. She needs some, but she doesn't need a lot. So I'm going to come in and I'm just going to feel, starting at the top, the ability for each of her ribs to spring away from the sternum. And she has a big limitation here at probably rib 4 or 5. And then as I continue to spring down, she has more of a limitation as I work down lower into her sternum than she does at the top. I can come onto the left side here, feel kind of the same thing. Similarly, although one higher, it's a little bit tighter there at 3 and 4. And then as I work my way down, it's not quite as bad. So it's like mid-lower on the right and then kind of upper-mid on the left side. So to work on that, just to give you an example here, I could do several different things. So my direction, I'm on the right side of her rib cage. My direction of force is, I'll tell you in a second, is actually up on this angle is the tightest. And I got a positive test there, okay? Meaning that she agrees with me. So I'm going to come in, localize depth. So I'm really kind of going down in that direction. Now from here I can have her breathe. So go ahead and breathe in. Good, I'm blocking it as she breathes in. As she breathes out, I want to take up that slack of getting that cartilage where the rib attaches at the sternum to glide away. All right, if that is working, I can continue to do that. If it's not working, I can then add in, the legs there, I got a positive that time, no noise, just stuff. And so from here, I could say, Keely, go ahead and move your knees in this little range of motion right here, back and forth, while I sustain that pressure. All right, and that is helping. So I like that. All right, I can also have her bring her hand behind her head, just like that. Bring the knees to that point that it tightens up right there, and then stay right there, Keely, and then raise your head up. Whoop, right there. That's all we got to do. And then breathe into that. And out. Okay, so you can go ahead and relax down. So I could continue to treat that, but that is working on decompressing where the rib becomes cartilage. The cartilage then attaches into the sternum so that again she can open up the front of her chest, allowing her shoulder blades to sit back, which will help with all kinds of potential issues as far as pain goes, limited breathing, and that sort of thing. Simon did not say to straighten your legs out, so please bend your legs back up. Okay, perfect. All right, so that is working on getting that separation or opening up the front of the chest. I can also follow that up with, since it was that lower portion that's the most limited, I could have her breathe into my hand. So Keely, go ahead and breathe into my hand. Breathe, come on, come on.
That hurt.
Okay, thank you for communicating that to me. Now, what we can do, channel your inner Zen. All right, so I'm here. Is that okay?
Yeah.
Very important that you communicate with your patients if something hurts. Now, go ahead and breathe into my hand. Good, good. I'll hold that and breathe out. Good, and breathe in, big, 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 good. I'm really encouraging her to get the breath in the area and breathe out. that she has a hard time getting breath, and it's the lower half of that sternum. Breathe in. Good. Come on, come on. I'm giving a little impulse to encourage that, and breathe out. Good. So that is just a way that after I separate the ribs away from the sternum to then encourage the sternum, the ability to elevate. Now, if she has the opposite problem, for the sternum specifically, I want to get that sternum to actually depress down. Okay, so with this, and I identified this in a previous efficiency video, but there's this spot right here where her sternum comes down, and then there's quite this big angulation down, which creates like a little bit of a kink in her sternum. We want to get rid of that kink. So Keely, things that I can do is I can continue with breath work, but I want to go straight to the hand behind the head position. All right, I am going to then localize into the tightest area, and I would like to be on that side of the table because it's actually down this direction, but I'm just going to do the best I can so I don't block the camera view. Good, and now from here, Keely, I want you to raise your head up with your hand right there, come back down, and blew through the restriction, come up slowly. Right there is where it starts to tighten up a bit more. And now from here, I can say, I'm on her elbow here. I could say, Keely, don't let me move you here. Hold, breathe in and out. Good, and try to raise up a little bit higher. There, don't let me move you here. Hold here, I'm pushing you down. Don't let me, good. You okay tenderness-wise? Mm-hmm. Good. And let it go. Good, try to come up a little bit higher if you can. Okay, so I would, and relax down. I would continue working in that range of motion until I felt like I achieved a springy infill or I wasn't improving any more mobility. All right, so those are two ways that are very influential and important to treat for both people that can't drop down and people that can't open up in the anterior chest.